Good morning, Rickey, Smiley, and happy Monday to you. It's time for the coronavirus update for August 3rd, 2020. We got 4.7 million cases and 157,000 deaths. But, Rickey, they reported on last Friday that excess weight increased your risk of serious illness and death from the coronavirus. One study found that for people with a BMI of 35 to 40, the risk of death from the coronavirus increased by 40%. And with a BMI over 40, the risk of death increased by 90% compared to those with normal weight. So that just shows, individuals that have gained this Corona 15 are putting themselves at 5 times risk for ending up in ICU if they catch the virus. So one of the things that's being recommended now, of course, is a more healthy lifestyle. And in Huntington, the public health department recommended that the entire town of 200,000 people go on a diet to decrease their morbidity associated with obesity and the coronavirus. So one of the reasons that the death rate is so high in the United States is because we have one of the highest obesity rates. Even though China has a lot of cases, the death rate is 6%. Because the obesity rate is only 6%. But in the United States, the obesity rate is 42%. And that is one of the reasons why, even though they have a lot of cases, they're not having as many deaths. That's also showing that younger people that are being admitted to the hospital more likely than not have obesity as an underlying risk factor. So this is one of the things that we have been talking about and continue to do so. And, there are other reasons that this happens. People that are obese have increased inflammation throughout their body, and the entire bad outcome from coronavirus is based on an inflammatory response. So they are more susceptible to low chronic grade inflammation. So they also usually have the comorbid conditions, hypertension, heart disease, and diabetes if they're overweight. So that's where we are with this today. So we need to eat healthy. We need to get our weight down, but it's a little more complicated than just telling people to eat less and exercise more. We have to do some things to help people lose that weight. So that's going to improve our outcomes with this corona, and hopefully have the numbers are going up exponentially in all areas, rural areas, urban areas. People that normally were counting on their isolation as a part of their corona response, are now showing increases in infections. So this is, again, worse than it has been at any point, yet we're still opening up some of our businesses. So I don't know. Yes.
No, tell them about your vitamins. I swear by that 5,000 milligrams of vitamin D that they need to take every day.
It's thought that if we could get everybody in the United States to get their vitamin D level above 40, we could cut the rate of this coronavirus in 4 weeks. So they thought that if we can get everybody to wear masks, it would take 8 to 12 weeks. So we need to get that vitamin D up 5,000 international units per day. Omega-3 fish oil as a supplement. Zinc is being highly promoted and is now part of the protocol at most of the hospitals in Georgia now. They're placing people on vitamin C and zinc. Those are things that are in our lipoimmune product. So we need to get, I'm telling all my educators, before you go back to school, if you're going to be exposed to students and you're at risk, you need to start boosting your immune system. So remember, Rickey, when it comes to the coronavirus infection, the 3 C's: avoid closed spaces, close contact, and crowded places. And the 3 W's: wash your hands, wear a mask, and watch your distance. And as always, this is the opinion of Dr. M.J. Collier, not that of the Rickey Smiley Morning Show or its radio affiliates.
There it is, y'all. The one and only Dr. M.J. Collier. Hey, appreciate you, Dr. Collier.
Appreciate you, Rickey. Have a wonderful Monday.